Patients always ask me, what is recovery like after a disc replacement surgery in the neck? A disc replacement surgery in the neck is actually one of the easiest recoveries for most patients having spine surgery. And the reason is our pathway in and out to fix the problem really doesn't cause very much pain. In order to do this surgery, we're actually able to go through a small incision in the front of the neck, and we're able to get into the disc without having to cut muscles or really retract much tissue. And with spine surgery, it's when we have to stretch or move muscles that people usually feel more discomfort. So the path in and out to do a cervical disc replacement is really well tolerated by people. Now, most people have a surgery. For example, this is an example of a one-level disc replacement. We can see one of the discs in the front of the neck has been removed and replaced by an implant. So this is a surgery that typically takes an hour to an hour and a half. And most patients are either going home on the same day or are spending one night in the hospital on observation and going home the following morning. Now, most people coming in for a surgery like this are having some kind of nerve problems with nerve pain down into the arm. That part usually responds very well. And I'm always hearing it's like a doll's arm and you unplugged it and plugged a new one in. And so the nerve pain typically goes away very quickly. And in fact, most patients, even before they leave the hospital, are already happy that the surgery is going to work for them. Now, after a surgery like this, we do want to be careful because we've placed an implant and we're waiting for the body to heal. So we typically do have people take it easy for the first few weeks. Most people are able to get off pain medicines either immediately or within the first 3 to 7 days, switching over to Tylenol, and are usually kind of getting out of the house and driving within the first couple of days. In terms of work, people who are doing desk work or Zoom meetings, those kind of things, I've had teachers do Zoom meetings 2 days after they've had this surgery. Now, we do have to be a little bit more cautious when we get into heavy lifting, physical activity, contact sports, and so depending on the patient, that may be more of 6 weeks, 8 weeks, while we're waiting things to heal in before we really set someone free to go do an unlimited life. Once the disc replacement is healed in completely, typically by 3 months, we plan to let patients go back to any activities they want. And so playing sports, roller coasters, you name it, we tend to let people go back and do those things as much as they want once they've had time to heal completely.